Hi, I'm Dr. Seth Force. I am the Kamal A. Mansour Professor of Surgery and Chief of Thoracic Surgery at Emory University Hospital in Atlanta, Georgia. The most common, adjunctive treatment is chemotherapy. It's less often that we actually refer for radiation. So why do patients need chemotherapy if you've taken out the cancer? So, what we tell patients is, say, for example, stage 2 cancer. So when we go in and we remove a lobe. Let's say you have a cancer in the upper part of your right lung, and we do what's called a right upper lobectomy, and we remove that cancer and all the lymph nodes associated with that lobe and all the lymph nodes around the chest. And if some of those lymph nodes have microscopic cancer, it's possible that we got all the cancer out. It's possible that we got out every lymph node, every cancer. It's also possible that there's an area of lymph node we missed, or the cancer had spread microscopically to another part of the body. And there's no way currently to figure that out, to figure out which patients, for example, with stage 2 lung cancer are completely cured by surgery, and which patients there is some microscopic disease still left. Because there are people who will be cured just with surgery with stage 2 lung cancer. There's just no way to separate which patients will and which patients will recur. So we know that the survival is improved in patients with stage 2, stage 3 lung cancer after surgery if they get chemotherapy. And that's really the bottom line. The bottom line is the survival is better. However, there may be people who are not good candidates for chemotherapy, and then we may we may just watch those patients and hold off on chemotherapy. Radiation's a little bit different, because typically, the most common scenario where we would recommend radiation after surgery is if we go in to remove a cancer and we find unsuspected cancer in multiple lymph nodes in the middle of the chest. And so we might want to radiate those lymph nodes. That's the most common scenario, but it's not that common. And it's interesting that if this isn't really your question, but one interesting point is that of all the patients that we take to surgery that we have staged as stage 1 lung cancer, so we've done PET scans, CAT scans, brain MRIs, and we think they're stage 1, 20 to 30% of those patients will have unsuspected lymph node disease that shows up on the final pathology. And I kind of tell all my patients who I'm taking to the operating room this, because I don't want them to just be shocked when we're going over the pathology report in the office after surgery, and all of a sudden I tell them, well, we thought you had stage 1, but you actually have stage 2, and we're going to need to give you chemotherapy. It's a little easier for the patients to really absorb this. If you've kind of mentioned it before surgery and you say, you look like you're stage 1, but we won't know until we get the final pathology back. And if it shows more advanced stage, you'll have to see an oncologist to talk about other treatment.